Welcome to another video of Food Nourish Deep Dives, the videocast of foodnourish.net, where we explore topics like health, food, supplements, and alternative approaches to health and wellness. So let's get right into it. Billions of dollars spent, decades and decades of research. And yet, here we are, still asking the same frustrating question. Why is there no cure for Alzheimer's? We're about to break down the claims in our source material that suggest the answer is, well, a lot more shocking than you might think. Okay, to really understand this whole controversy, we first have to talk about the official story, the one single theory that has absolutely dominated Alzheimer's research for over 100 years. Get this, $3.9 billion. That's how much the National Institutes of Health, the NIH, poured into Alzheimer's research in 2024 alone. It just goes to show you the incredible financial machine that's been built around finding a cure. For over a century, the guiding light has been the amyloid hypothesis. The idea is pretty straightforward. Sticky plaques, made from a protein called amyloid beta, build up in the brain, and that's what kills nerve cells. So, because of this one idea, almost all research, almost all drug development has been laser-focused on a single goal: get rid of those plaques. But, after decades of failed drug trials, the critics have gotten a lot louder. This quote from a 2022 article just nails the frustration. It compares the amyloid hypothesis to that ancient, totally wrong idea that the sun revolves around the Earth, a theory that people clung to for way too long, even when the evidence was screaming otherwise. And that is where this story takes a really dark turn, because we're now at the core claim from our source material that there's a massive crack in the very foundation of this whole theory, one that's rooted in an accusation of monumental fraud. So picture this, it's 2006, and skepticism is growing. Then this one paper drops in the super prestigious journal Nature, and it felt like the smoking gun. It claimed to have found the specific bad guy, a toxic little piece of amyloid they called A-beta 56, and even showed it caused dementia in rats. This paper became one of the most cited works in the entire field. It reignited the theory and helped steer billions more in research funding. So how did they prove this? The key piece of evidence came from a technique called a Western blot. Now, you don't need to be a scientist here. Just think of it as a very specific kind of photograph that lets researchers see and identify individual proteins, like A-beta 56. This is an absolutely crucial part of the story, because the central allegation is that those photographs, the Western blot images in that hugely important 2006 paper, were manipulated. The source claims they were doctored to show a result that just wasn't there, essentially fabricating the evidence for this toxic A-beta 56 protein. Now, the fallout didn't happen overnight, not even close. According to the source, a neuroscientist first flagged these issues in 2021. But get this, the NIH was notified, and the lead researcher reportedly received another grant. It wasn't until Science magazine published a massive expose that the story really blew up, and even then, the paper wasn't officially retracted until 2024, a full 18 years after it was published. The lead researcher finally resigned a year after that. It's just an incredibly slow unraveling. And this wasn't just some academic squabble. The source argues that building an entire industry on this shaky foundation had devastating real-world consequences, involving unbelievable amounts of money and, most importantly, patient health. $56,000. That was the initial annual price tag for Aduhelm, the very first amyloid clearing drug to get the FDA's approval. It was a price so incredibly high, people were genuinely worried it could bankrupt Medicare. The controversy around this was stark. The FDA's own independent panel of experts voted overwhelmingly against approving the drug. Look at these numbers, 10-0 against, with one person abstaining. It was a total rejection. And yet, the FDA approved it anyway. The backlash was immediate and fierce. 3 of those FDA advisors actually resigned in protest, with one calling it probably the worst drug approval decision in recent U.S. history. That just highlights the massive chasm between the outside experts and the agency itself. And beyond the debate over whether it even worked, there were serious risks. The clinical trials for these amyloid drugs reported some really dangerous side effects. A staggering 41% of patients taking Aduhelm experienced brain swelling or bleeding. That is not a small number. All right, speaking of health and wellness, let's just take a quick pause here. If you're someone who's looking for deals on supplements and other wellness products, you should definitely check out foodnourish.net/deals. That's where you'll find all the latest offers from some really big brands like Perpetua Life, iHerb, Source Naturals, Nootropics Depot, and Bioptimizers. The link is right there for you in the description below this video. So, if the mainstream approach has been so costly and, according to our source, potentially fraudulent, what about alternatives? This is where the article pivots to therapies that it claims have been ignored, precisely because they aren't easy to patent and turn into blockbuster drugs. And this slide, based on the source material, presents a really stark contrast. On one side, you have the amyloid drugs, high cost, severe side effects, and an outcome of slowing decline by about 27%. On the other, the article points to alternatives like MCT oil or DMSO, which it claims are low cost, have no major reported side effects, and in one study showed 80% of patients remaining stable or even improving. The article also includes personal stories to back these claims up. This testimonial from a reader, for example, describes just a dramatic turnaround in a loved one's condition after trying DMSO, saying she was able to talk again after a year of silence. And the source also digs into animal studies to support these ideas. For instance, research on rats reportedly showed that DMSO could protect brain cells, prevent damage, and significantly improve memory. The argument is that this promising line of research has just been largely forgotten. Another approach that gets highlighted is the RE code protocol. Instead of just treating the symptoms, like trimming the leaves on a sick tree, this protocol tries to find and treat the specific root cause of cognitive decline for each patient, using what the source describes as natural therapies. So, what does this all add up to? The source argues that this whole story of Alzheimer's research really reveals a fundamental problem with the medical system itself. The article's ultimate conclusion is that the system is just structured to favor profitable, patentable products over everything else. It suggests there's a huge focus on commercializing drugs that manage symptoms rather than truly investigating the root causes of illness or exploring affordable, natural therapies that might offer an actual cure. We have covered a lot of controversial ground today, all based on the claims in the source article. To really dig deeper for yourself, you can check the video's description for a link to the original resource. Please like this video to help us grow our channel and continue delivering these deep dives on health matters. And of course, subscribe so you never miss another video. And that leaves us with this final, crucial question. Based on everything presented in the source material, is the failure to find a cure for Alzheimer's a problem of science just being too difficult? Or is it a problem of a system where the economic incentives might be pointing us in completely the wrong direction? It's something to think about. Thanks for watching.